Welcome back to another episode of the Business Muscle Podcast. Today we are diving into what you actually should be doing during pregnancy. Not the random advice you might see online, but what's backed by science, taught by pelvic floor physical therapists. Today, Ariel, not only the co-host, hi Ariel.
Hi.
But also a pelvic floor PT who works with women every day through pregnancy, postpartum, and she's going to break down exactly what you should be doing in each phase, from early pregnancy to third trimester. Eventually, we're going to talk about after birth, but we're going to be talking all things how to protect your core, train your pelvic floor, stay strong, prepare your body. The list goes on and on. This is probably the topic we get the most questions of in Fixed and Sweat Fix recently is, what do I do when I'm pregnant? What's safe? All the list goes on and on. So today we're going to grill Ariel.
I never get introduced on this podcast.
Yeah, well, today
no
is
one
your
ever
day.
Introduces me. This is great.
Today is your day.
I'm excited.
I have a whole list of questions that the people want to know.
I could talk about this all day. I'm pumped.
Yeah, so let's jump right in. So why do you think so many women are confused about what they can and can't do during pregnancy?
Oh my gosh, because it's confusing. That's the short answer, is that it's confusing. But I feel like there's so much information out there, even just now having gone through it myself. The questions that I had for my OB and their answers versus what I would see online versus what I would hear from friends. There's so much misinformation out there. So it's really hard to get a clear-cut answer on anything when you're pregnant. Plus, there's just not a lot of research happening for pregnant women. So a lot of things there just is no answer.
So let's start. What is the truth? Like the whole myth about working out. You're not supposed to be working out. You're supposed to be working out during pregnancy. Give us the tea.
You need to be strength training during pregnancy. That's the bottom line. I mean, your body goes through so many changes when you're pregnant. Your pelvis expands, your rib cage expands, your breathing changes. You're literally carrying around a bowling ball in front of you for at least for the whole third trimester. So if you don't prepare your body for that, it can be really challenging to make it through your third trimester without having low back pain, without having hip pain, having lots of other issues postpartum. So strength training can help prevent a lot of those issues, and it can help you just feel so much better throughout your whole pregnancy.
A lot of people that I talk to, they're scared though. So what do you say to people that are scared? Even if their doctor, like the doctors now, they say like go strength train, but even if they're still scared, what do you say to those people?
Yeah, I mean, if you're not sure what to do because it is so confusing and there is a lot of information out there, go work with someone who knows what they're doing and who can look at you and figure out where your impairments are, what your starting level is, what your baseline is, and give you a program that's based off of your needs and your goals, because it's really hard to find a generic strength training program in general, but then add pregnancy on top of that, and it can be really confusing. And there's a lot of conditions, we totally understand that there's things that can happen with your blood pressure or with your placenta placement that can make it challenging to work out the same way that you did prior to pregnancy. So that's an even more of a reason to go work with someone who knows what they're doing and can give you the right advice, because it might be you need to work on breath work or you need to work on mobility work more than the typical exercises that you were doing pre-pregnancy.
Yeah, if this is one thing that I wish we could just like ease people's fears with, is that working out is going to help them so much during, and then especially during labor and then after. Like they need to start strength training now. But let's rewind a little bit. So pelvic floor, a lot of people don't even know what pelvic floor health is, but why, if you're newly pregnant or if you're currently pregnant or you're about to be pregnant, why should you care about pelvic floor health? And what is it, I guess? Yeah,
so I'll give you like the quick and dirty version of what the pelvic floor is. So your pelvic floor muscles sit on the inside of your pelvis. They have two important roles. One is they support the pelvis, just like your lower back muscles, your core muscles, your glute muscles. When you're walking around day to day, those muscles are on so that you have a stable pelvis to move on top of. But they also have important function with labor and delivery, bowel and bladder health. So if those muscles are doing more of a role stabilizing your pelvis just with day-to-day movement, because now they're taking on this increased load of pregnancy, your body is changing, your pelvis is expanding, and now you're taking on more weight anteriorly, those muscles become really stressed out. So they're working harder just to stabilize your pelvis, which is why so many women experience issues with the other function of your pelvic floor, which is bowel and bladder control, and can have a difficult labor if you have tension through your pelvic floor and experience leakage and pelvic pain and all of these things postpartum, is because those muscles go through so much change during pregnancy. So your pelvic floor, a lot of women don't even realize that they have a pelvic floor or what their pelvic floor is doing until they go through pregnancy, because it goes through so many changes. But you need those muscles even just with normal day-to-day life, even before you get pregnant. So going through pregnancy, you experience all of those changes in your pelvic floor. And the more that you can bring awareness to it, learn how to actually contract and relax those muscles appropriately, can help reduce all of the issues that you can experience after delivery.
It's crazy because when I had Mason, like that whole pregnancy, I didn't even really talk about or think about my pelvic floor. I feel like there's no like education. And then Micah, because you became a pelvic floor PT and we really got into it, obviously everything changed. But had I not been so close to you and fixed and had these great resources, I would have had no idea. So how come like females just have no resources now? It's like not really talked about when you're going through a major life change. Your body is completely shifting. You're going through a huge, some people surgery if they have a C-section, and nothing is spoken about.
I don't know.
Like what is the answer to that?
This is what we're trying to change, right? But yeah, no, I agree. I mean, I think every woman who goes through delivery, whether it's a C-section or vaginal delivery, should go to physical therapy after they have a baby. Everyone should go to physical therapy while they're pregnant. I don't really understand why this isn't like doctor's number one recommendation for women going through pregnancy and postpartum. During pregnancy, you have a million appointments, right? They're always checking on the baby, checking on the growth of the baby, which is great. Your doctor's keeping eyes on you. And then postpartum, you literally have one appointment. You're not seen again. So you can have issues that develop immediately postpartum. You can have issues that develop 2 months, 4 months, 6 months down the road, years later, that if no one ever has eyes on you because you're not being seen postpartum, that's when you would have no idea that those are even related to your pregnancy and your delivery. So I think that everyone should go to PT
Me too.
during these
Me
two
too.
periods. But hopefully that now we're talking about this and there are more places that are offering pelvic floor PT. And I feel like more women are becoming more comfortable talking about it. Hopefully we're sparking that change. But yeah, it's kind of crazy some of the things that we hear doctors tell our clients as far as like recommendations go for pelvic floor health.
Yeah. What are some of the craziest things you've heard?
Like if you have pain with intercourse, just have a glass of wine before intercourse. Like, what is happening?
It is crazy.
What is happening?
I just think about I tore my ACL when I'm getting ready for that surgery. I went through PT. I did all this strengthening. I prepared my body for this major surgery. But then you're getting pregnant, you're going through this major body change. It's a huge event that's going to happen and completely change your body. And we tell females to walk.
Right.
Or to bounce on a ball. Right. Yes. It doesn't make any sense to me.
It doesn't make any sense. And if you say, I've had a lot of women experience that they tell their doctor I have this pain or, I have leaking now. And their doctor's like, that's just part of pregnancy. It'll go away once the baby's here, which is actually not true and is not a normal part of postpartum recovery. So these are the things that we can make change to by strengthening the right areas and getting mobile in the right places, which I think a lot of people don't realize.
Yeah, I've been seeing a shift though, at least at SweatFix, all the strong pregnant ladies that are in the class. It's crazy. Like Emma Brown carrying twins, just any class you go to in SweatFix now, there's a pregnant person in the class picking up 17s, 20s, 25s. Literally Emma is carrying twins and she's picking up the 25 still and she's push pressing with them.
I love that.
And it's just that's where when I see that, I'm like, wow, maybe everybody's starting to pick up on this is super important for you, for your health, for the baby's health, just for a smooth delivery. And I'm all for it. I'm excited.
Yeah, right. Because especially if you've been told not to lift weight during pregnancy, don't lift over 25 pounds. That's another thing that we hear women say that their doctors have told them. Then they send you home with an 8-pound baby, 12-pound car seat, all of these things that you then have to be able to magically lift when you haven't lifted anything for 9 months. It doesn't make any sense.
Or they have a 2-year-old or a 4-year-old and they're already picking that kid up.
Right.
So how are we picking up my 50-pound Mason?
Right.
But I'm not supposed to lift anything? It doesn't make any sense.
It doesn't make any sense.
So what is the biggest I wish I knew this sooner moment that let me say that again. What is the biggest I wish I knew this sooner moment that your patients tell you postpartum?
I think the hardest thing to get back postpartum is how to activate your deep core muscles, your TA muscles, because those muscles go through so much stretch during pregnancy. But if you work on those muscles and learn how to connect your brain to those muscles during pregnancy, when those muscles are really stretched out and it's a really difficult time for those muscles to activate, it's so much easier to get them to fire postpartum. But it's a muscle that's really hard to feel. So a lot of women don't realize that they can even activate those muscles, like do a proper brace. We see a lot of women like bear down when they're bracing or hold their breath when they're trying to activate their core. And then postpartum, when your body just goes through this drastic change of delivery, it makes it even harder. So one of the things that a lot of women wish that they had done sooner was come in and learn how to brace, learn how to breathe properly, learn how to actually activate their core.
Yep. So I know a lot of people want to just break it down. They're like, Ariel, just tell me what to do. So that's what we're going to do. And we're going to take it trimester by trimester. So obviously first trimester, what are some things that you tell somebody that just found out they're pregnant? What are they going to start doing today? Day one, you get the pregnancy test. What do we do?
So a lot of times like how I like to think about pregnancy is it's going to be like a 9-month gradual deload. So if you're already strength training, you're already lifting heavy weight in the first trimester, you can continue to lift those heavier weights like around what you were doing before. It's really hard for someone to say like, just continue with what you were doing before, because there are things that we will modify even as soon as the first trimester. But you want to make sure that you're not holding your breath when you're working out. That's one of the main causes of pelvic floor dysfunction and leakage and not being able to connect to your core. You want to make sure that you're staying mobile, you're staying strong, you're continuing with movement as you're able to. I know personally, I had a lot of nausea in the first trimester, so it was hard for me to show up for workouts like I was able to previously. Like I probably was only working out 3 times a week and it was like 20 minutes and that was it. And that was fine. That was as much as I could do. But so just be patient with yourself during the first trimester. If you're not feeling well, continue with strength training. You can continue with, if you were running before, a lot of women have good success with still running in the first trimester, continuing to do strength training, and then just seeing what changes your body goes through, because everyone kind of goes through changes at different points of time. So for a lot of women beginning in the second trimester, that's when we want to start to look at, are we getting any coning or doming? Those are some of the things that will come later on. But usually in the first trimester, you can stick with the typical core exercises that you were doing previously.
Yeah, I was going to say, what do you tell people to avoid?
As a general rule, I don't usually recommend planks unless you can demonstrate a plank without any coning or doming. So coning or doming is, you'll see like a little bulge that pops up above your belly button, and that is just an indicator that your body can't manage the pressure in the system well. So your pelvic floor, your diaphragm, and your abs all have to communicate when you're doing an exercise. And if the pressure is not being managed well, then you'll see coning or doming. And all that means is that your body isn't able to manage the pressure in that position, and we should just modify that one exercise. So some women can do planks until they're 30 weeks. Some women have coning or doming with planks at 10 weeks. So it really is important to go get checked and see what positions are causing those issues. And if you are having those, then coming up with other modifications to do.
Yeah, usually in the first trimester, I tell people like planking and stuff is okay because usually there's not as much coning. Right. But then come the second trimester, I'm like, it's not even worth it. Like, I'm not going to be the one that checks them. They'd have to go to you. But usually that's when I'm like, go to a side plank, like things that we can start to drive your core back together. Because side planks, you can do the whole time. Yep. All the obliques and stuff like that. You have no problem with that.
Yeah, that's definitely more rare to see coning in that position. And there's lots of ways to modify a side plank too. You can go bottom knee down. You could go both knees bent. Those are great options for a side plank. But yeah, bird dogs are a great option if you're not sure what other exercises. Even dead bugs are a great option first and second trimester, just depending on how you're feeling.
What about twisting? Like bicycle crunches? Like a lot of people say, they'll come to me, they'll whisper, I'm pregnant. Don't tell anybody. I'm not going to be twisting. I'm not going to do any core anymore.
Yeah, right. So same rules apply with twisting. I think a lot of women take that like no twisting. They're like, oh, I can never rotate in my life again. But that's not true. Like you could do like thoracic mobility, like windmills up against the wall, or like a foam roller reach through. Like you can rotate through your upper body. I just wouldn't put that under load. So like a Russian twist, I would stay away from a position like that. Bicycle crunches, I would do like a modified version, more like a heel tap or like a march, just because that is a really common position to get coning or doming.
Okay, and am I starting to do my Kegels now? Am I working on relaxing my pelvic floor in trimester 1, or does it not really matter just yet?
You could start to bring some attention to your pelvic floor. Mostly what I would focus on in the first trimester is just making sure you're not holding your breath and thinking about inhaling when your muscles are lengthening and exhaling when your muscles are contracting. So take like a bicep curl, for example, on the way up, you want to exhale. And then on the way down, when the muscle is lengthening, that's when you want to inhale. Start thinking about how to pair your breath with the movement. I actually don't really recommend Kegels much anymore. The pelvic floor muscles do tend to naturally contract while you're doing other exercises. Most women that I work with are tight through their pelvic floor, and a lot of the issues that they're having are coming from having too much tension in their pelvic floor, which is also really common during pregnancy as your pregnancy starts to progress. So I wouldn't go crazy with Kegels. Your pelvic floor is likely going to be strong enough, but some things that you can do to help with pelvic floor relaxation and reducing tension. Child's pose is a great stretch with some deep breathing. You can do like a deep squat with your arms out in front of you. That's a great way to open up the pelvic floor. And happy baby pose, if you're familiar with yoga at all, that's a great one to open up your pelvis.
And when should somebody start working with a pelvic floor PT? Is it in trimester 1, or is that when we start to like see the change where your body actually starts, you get to you start showing and you start to feel a little bit aches here and there?
I would come in as soon as you find out that you're pregnant. Like as soon as you're moving well, you can start to work on some of these things, start to work on your breathing. There's lots of things that even just education wise we could go over, and just looking at your specific body mechanics. Even though you might not be feeling a ton of change yet, it's a good time to just get a baseline. Even if you came in for say 2 visits in your first trimester, and then we started to increase the frequency in the second and third trimester, it's great to just have a good baseline, get that check of what core exercises are safe for you right now at this point in time, because you can always progress things. You can always come in more frequently down the road, but I say right away.
Okay. So then we head into our second trimester, and somebody like me, like I did not change my weights. When do I get to the point where I'm like, I know that it might be starting to be too heavy? How do I know if it's too heavy and I have to start pulling back? Or does the second trimester, I just keep chugging along?
Well, this depends. It's everything depends. I know everything is so individualized, but it depends on what the movement is, and it depends on what your fitness level was previously. But I would just pay attention to your symptoms. So if you have, I like to look at like a 24-hour window after you do any type of exercise. So if you have any lower back pain, round ligament pain, hip pain during an exercise, definitely hold off on that or decrease the load. But also if you have any of those issues 24 hours later, like look at that window and see, is anything bothering you in the first 24 hours? Because that could be related to some of the strength movements. And sometimes it can feel like it happens quickly. Like I feel like this happened to me in the second trimester where I wasn't nauseous anymore. I was like, nice, I can get back in and like lift heavy again. I just felt so weak and so deconditioned early on, just because your ligaments become so lax. There's a hormone that circulates through your whole body. It's intended to open up the pelvis, but it affects all of your joints. It's called relaxin. And that makes it so that your muscles have to work even harder to stabilize. So you really just might have to decrease the load slightly, even as early as the second trimester.
What are some go-to strength and stability exercise for your pelvic floor and just in general that people should be doing in the second trimester?
Yeah. I mean, any type of squat pattern is great. I would definitely work on single leg movements, especially if they still feel okay. Like if you're not having any pubic symphysis pain, lunges, step ups, lateral step ups, work in like different planes of motion too, like a forward step up and a lateral step up or a lateral lunge. That can be really helpful for your adductors and for your glutes. I also love hinging. So you need your glutes to be able to lengthen, and during pregnancy, your pelvis expands. So your glutes become lengthened, and we have to learn how to activate those muscles in a lengthened position. So any type of hip hinge, so like a deadlift or like a single leg RDL, those can all be really helpful during pregnancy to learn how to stabilize those muscles the right way.
Oh, all these things keep popping into my head, but I'm like, heart rate. That's another thing that people like hit workouts. I can't get my heart rate over 100 and whatever they say, 130, 140. What is the deal on heart rate?
Yeah, that's old data too. But again, it's individualized. It depends on if you're having blood pressure issues, like that's something where we really have to monitor your heart rate during your workout. If you're having dizziness or lightheadedness, then that's the case where you might not want to get your heart rate up as high. I find that a lot of women don't feel super comfortable getting their heart rate into a higher heart rate as early as the second trimester. So it depends on the person. But for me, what felt the best was strength training and walking. And then like occasionally doing something a little bit higher intensity as well. But that was like the sweet spot for me during pregnancy was those two things.
Yeah, I strength train almost every day, and then I would do a lot of zone 2 cardio where I would just get on the bike for like 30 or 40 minutes at a pace that was like not comfortable, but like I could hold an uncomfortable conversation.
Right.
Like that's how you know you're in zone 2 is if you can talk, but you don't really want to talk. And you're like, so your heart rate's not jacked up and you can hold it and maintain it. I did a lot of zone 2, but then honestly, it was mostly strength training.
Yeah. I feel like that's what feels the best for me in postpartum too, is strength training and walking, and like incline walking sometimes if you want like more of a sweat, or if you're a runner, like just reducing the pace a little bit. But those are my 2 favorites.
What if somebody is starting to leak, like, or even like they jump or they sneeze and there's some leaking? Is that something to be concerned about when you're pregnant?
It's definitely not normal. It's common, but it's not normal. And there are things that you can do for it. A lot of the times during pregnancy, if that's the case, your pelvic floor is probably so tense because it's doing that stability job. All of the other muscles like your abs, your lower back, and your glutes are becoming weaker because they're lengthened. So your pelvic floor is just so stressed out. So if that's the case, you need to work on lengthening your pelvic floor, relaxing those muscles, and strengthening everything else without getting your pelvic floor so jacked up.
And then you start to feel really large. We're entering our third trimester.
Large.
This is the phase where everything really starts to feel heavy. It happens like overnight. You like all of a sudden just pop. And this is when a lot of people, thankfully, I followed your protocol and I did everything correctly. I didn't have this. I feel grateful, but a lot of people, lower back pain starts to set in. What causes this lower back pain in third trimester for a lot of people?
One of the common causes is the hinge point in your spine changes. So your whole center of gravity shifts forward because now the baby is pulling you forward essentially. So it puts a lot more extension through your lumbar spine. The hinge point of where you normally flex and extend moves up higher. So I got a lot of like mid-back pain and mid-back tightness during pregnancy too, which I think is pretty common. But also like those muscles are just becoming weaker and more lengthened week after week after week as your abdomen expands. And it's hard for your body to keep up with that strength. So that's where doing a lot of like deep core work, being able to brace in different positions, like on your hands and knees with rotation, that can all be really helpful to help you continue to engage those muscles as they get more stretched out.
Yeah. What's an example of like deep core we should be doing it in the third trimester?
So you want to think about when you're bracing your deep core, you want to think about inhaling through your nose, and then as you exhale, drawing up and in. So you want to feel like a little bulge in your lower abdomen, almost as if what you would do if someone was about to punch you in the stomach.
Even when your baby's there though, you can feel this?
Yeah, you can feel it. It's a good cue during pregnancy is to hug the baby towards you. But there's lots of different ways that you can strengthen that muscle. You could just brace, like laying on your back, which we should talk about laying on your back in a second. But I love Palloff presses, like on one knee forward, one knee down, like half kneeling. That's a really good position to strengthen in with a band pressing straight out in front of you. You could do that same position with a rotation. I love any type of bird dog where you're extending opposite arm, opposite leg. You can do that with resistance. You can add a yoga block under your knee if that doesn't feel like it's challenging enough. There's a lot of different ways that you can stabilize.
Yeah, you were just saying on your back. That's another thing. We have benches and sweat Vicks, and some people just feel more comfortable, like if we're going to be doing chest press.
Yeah.
I think it's because it's so like drilled into us, don't lay on your back.
Right.
But what's the truth about that?
Yeah, that's definitely another thing where it's like most of the time, like I wouldn't sleep on your back. I wouldn't stay on your back all day. But if you're going to do that for an exercise and you feel fine, then that's a safe position to be in. Your body will tell you. You'll get lightheaded, you would get dizzy, you would get flushed. If you're in that position for too long, the baby can compress your inferior vena cava, which returns blood to your heart. So we don't want to mess around with that. But your body will feel that happening. So you would get symptoms from that if you're on your back for too long. And some women don't ever experience that. Some women have it as soon as they lay on their back. So that's another thing where you have to just feel what's going on. And if you feel more comfortable with an incline, just do things with an incline.
And is there such thing as labor prep workouts, or is that a myth? Is there things we can actually be doing to help for labor?
Definitely.
Okay.
Yeah. Oh yeah, definitely. Yeah. There's a lot of hip mobility, because if you've been through delivery, you know, your hips need to be, they need to be externally rotated, like knees out wide at the beginning of delivery, but then at the end of delivery, you need to internally rotate.
Remember, I
hips.
said one thing. The only advice I gave my pelvic floor PT friend I was like, knees in, toes out, which sounds weird. putting your knees in and then if you get on your back and you do it at home listening to this, knees in and then toes out, you feel your pelvic like open.
Yes. Yeah. So one of the things that we work on a ton during pregnancy is internal rotation because it opens up the back of the pelvis. Or if you have pelvic floor tension, like any exercise where you're internally rotating your hips helps open up those muscles. But
yeah, I remember the nurses were like, no, just open your knees. I was like, Johnny, you have one job. Do not let them just like crank me open and like squeeze like you're taking a poop. Like, no, I feel like that's a whole nother episode of actually like squeezing, pushing like you're squeezing toothpaste, but like knees in, toes out.
Yeah, because it opens up the back of your pelvis. And that learning how to brace, learning how to actually exhale and use your abs helps so much with pushing too.
So for somebody that's coming in, and can you just walk me through what a normal, like what would it look like? I get pregnant, all of a sudden I find out I take the test and I'm coming to pelvic floor PT. At the beginning, am I coming once a week? Like when do I start to really ramp up the sessions?
Mm-hmm. Yeah, usually I will have women come pretty infrequently in the beginning. Like let's just get a baseline. Let's give you things to work on at home. So probably like every other week in your first trimester. Then the beginning of the second trimester, we can keep that spaced out frequency, but we start to ramp it up towards the end of the second trimester because that's when your body's going through a lot of changes. That's when a lot of women experience lower back pain, round ligament pain, pubic symphysis issues. Like those are the things that we really want to make sure that we can address and keep you really strong. And then third trimester, then we start focusing on labor prep. So like towards the end of the second trimester, that's when I would start coming in once a week and continue with that frequency until delivery.
I love it. I'm going to give you some quick, fast hitting true false statements and you're going to give me your thoughts on them.
Nice.
So we kind of touched on this one a little bit, but peeing when you sneeze is just part of motherhood.
False.
What would you tell somebody to do? What could they do at home now to kind of start fixing that?
Usually, I mean, obviously go get screening, make sure this is the case. But I do find that a lot of women with urinary incontinence issues, if it's like running, jumping, coughing, sneezing, have really poor adductor strength, like your inner thighs. A lot of times those muscles can help support the pelvis so that your pelvic floor isn't doing all the work. So strengthen your adductors, step one.
You shouldn't lift more than 20 pounds when pregnant.
False.
Yeah, if we haven't screamed that from the top enough.
I know. I'm like, my baby's already so heavy. I don't know how. I understand why so many women have back pain after they have a baby if they didn't do some of these things during pregnancy. I did all my pelvic floor rehab and I still felt like it was so hard to get some of these things back.
Crunches are off limits as soon as you can see the bum.
I don't love crunches anyway.
Me neither.
I know. I feel like that's essentially the position that we do to test for diastasis. So yeah, I don't love crunches. I don't usually recommend them.
Never do them, even if I'm not pregnant. Same. I feel like there's so many other great exercises. I'd rather like get in like a half kneeling windmill and like work on full like functional core stuff than just like a little crunch.
Right. So marches, standing core, anything where you're holding like a weight over your head or a weight only on one side. Those are great ways to challenge your core without doing a crunch. I
did so many, as soon as you show me the band workouts, so like get against the wall, put bands around my feet and do like hip flexor and like lower. I did those hundreds and hundreds and hundreds of times. I feel like while I was pregnant. So there's so many better ways. Even if I skip crunches, people, there's other ways to do it. You can't fix diastasis recti.
False. You can. Do you want more of an elaborate answer than that?
Yeah, I'm a perfect case. So I didn't have it the first time when I had Mason. And
you didn't even have it right away with Micah either.
With Micah I didn't, but I have a hernia. So I don't know. I stopped doing all my warm-ups. I just started like, life gets in the way and you're like, I'm just going to rush and lift. And then I started to notice that my hernia was bothering me. And that's when I had you check me and you're like, I had like 2.5, 3. It wasn't like a big one.
No.
And then I was like, well, shit, we need to fix this. Cause I went to my hernia doctor and they're like, yeah, we'll just do surgery. And I literally said to him, well, can I just do exercises and fix the DR? And he's like, oh yeah, or you could just do that.
That seems like it might be a little bit easier than surgery and then going through recovery.
Yeah. But I think it took me like, I don't even know. We said we were going to do like a 6-week protocol. After week 2, I was like, Ariel, recheck me. And you're like, yeah.
It was already improved.
It was like, I don't even know, like a half a finger, 1 finger.
It's crazy.
Which is not even considered DR, right? So it's how many fingers is considered?
Two or more.
2 or more. So yeah, it actually works. Every time Ariel fixes something on me, I'm like, wow, this actually works every time. I'll hurt my back. She'll dry needle me. She'll tell me to like actually warm up, and then I feel better the next day. And I'm like, wow,
weird.
Every time,
weird?
I'm always amazed.
So weird. I do feel like the pelvic floor stuff. It always surprises me how fast people see changes too when they start doing these things.
Yeah, it is. I'm always shocked, but it's awesome. People that have had this for like years and years, and then like, what's the oldest pelvic floor client you've had?
60s.
Yeah, and they've probably lived with that for a long time.
Right. Yeah, like that had kids 30 years ago and have like a different type of incontinence, like urge incontinence, where there's been pelvic floor tension for years, but you can still make changes years afterwards.
All right, back to my true false. Just listen to your body is good enough advice during pregnancy.
It's not. And I hate that phrase because, I mean, there's so many things that are really important to focus on during pregnancy, which we didn't even talk about. Like thoracic mobility is really important because your rib cage goes through so many changes. You need to work on your adductor strength. We touched on this a little bit, but your internal rotation strength, those are like probably my top 3 things to work on during pregnancy. Learn how to internally rotate, strengthen your adductors, and work on your thoracic mobility. And just listening to your body, you wouldn't accomplish those 3 things. So I think it's well-intentioned, but there's more to it than that.
Yeah. You actually need to work on relaxing your pelvic floor during pregnancy.
Yes. Most of the time, yes. I would say that's true. A lot of times the pelvic floor is just taking on a ton of new tension from the weight of the baby. And a lot of us don't even realize that we're holding our breath all the time and we're clenching and you're in a different position. So your pelvic floor muscles are naturally so much more tense. So inhaling in like a deep stretch is a really good way to start lengthening your pelvic floor.
You can work out before you hit the 12-week mark.
True. Yeah, true.
Yes, true. Say that with a confident
I was like 12-week postpartum. No, I was like, 12 weeks of pregnancy.
I gave you a lot of false ones in a row. I need to switch the wording of this one so it's not false.
Yes, true. Yes, especially if you feel good, definitely continue.
I think a lot of people that have had tough experiences are very nervous at that, and which is understandable. You do, at the end of the day, you do mentally what's going to make you feel comfortable because it's a very emotional. And so if you've gone through some tough times and you want to wait till you hit that mark, which makes you feel like in your head you're in the clear, then I would say do that.
Of course.
But I always tell people it's totally fine. But if you're not going to feel like it's fine, for me, it's like, it's not even worth it. Just wait until you get to that mark.
Right.
But then you are going to be a little bit behind, right? You're going to lose, like, depending on how early you found it, you're going to lose like 6 weeks of strength training, which you lose it a lot quicker than you gain it.
Yes, this is true. Yeah, do what you're comfortable with. Absolutely. But you could always seek help from a professional to make sure that what you're doing is safe too.
Yeah, that's probably the best way if you're nervous is to just go work out with somebody.
Right.
And a lot of people think that the pelvic floor PT is just you're sitting there and you're doing like clamshells. Can you give it insight of what it can actually be? Because at Fixed, it's more performance PT.
Right. Yeah. And if you are someone who doesn't want to do a ton of weight and like you want to focus on just band work and mobility work, we will tailor it to your needs and your goals. A lot of times we do include at least some band work because a lot of people have strength deficits that aren't ready for a lot of load yet, but then we're working our way up to being able to use dumbbells, kettlebells, barbell, even working on progressing your strength so that your body is resilient for the things that you're going to be doing in your everyday life.
If you could go back, you just had baby Austin and you could change one thing about your pregnancy and do it over, what would you have changed?
Oh my gosh. Now that I feel what it's like to go through delivery, I would have, well, you saw my post yesterday. I would have strengthened my adductors a lot more because it took me so long to be able to actually do like a Copenhagen plank again. They were so weak postpartum. But also I probably would have worked on a lot more hip mobility because I just felt really tight through my hips. And I was doing a ton of strength training, but I think like towards the end, now feeling what delivery actually feels like and the positions that you need to be in that help the baby go faster, I next time will work on more hip mobility.
If you had to leave everybody that's listening to this with one piece of advice, they would listen and do one thing that you tell them during their pregnancy, what would it be? That you can only pick one. They're gonna eat Cheetos and do whatever the rest. Like they are not like, what is the one thing that you could do?
At least see a pelvic floor PT for one visit. Just get screened. Get screened for diastasis, get screened to see what exercises are safe for you. Like at least come in and do that much. I think that would be a huge, just give you so much peace of mind, make sure that, you know, things are looking good, make sure that you're strong in the right places, and then hopefully continue as well. But if you're only going to do one, at least do a screen.
Yeah. And don't eat Cheetos. I was just kidding.
And don't eat Cheetos.
Keep working out.
But if you have that Cheeto craving, you know, sometimes you got to scratch the itch.
Yeah. So if they want to come work with you, if they want to see a pelvic floor PT, how do we do it?
You can book a phone consult with us at fixstudios.com. We have our calendars on there for myself and Chris. She's also fantastic. She's a wealth of knowledge. You can find us on Instagram. I'm Dr. Ariel.tpt and Fix is Fix Studios.
Also, a lot of people that aren't local have been reaching out.
Yeah.
Can you even do virtual? Is it like the same benefit?
Yeah. It's different because we don't have that like hands-on piece, but I actually just have a client who I've been working with virtually, and we're working through some postpartum stuff, just working on like getting her glute strength back, which she has some equipment at home, and we've just been working mostly on exercise, which is what a lot of our sessions are based on anyway. And then for areas that she needs to work on like mobility or like release, she's using her foam roller, and I'm giving her some techniques to do at home for that too. That's
great, because if you're not near the Wakefield or Haverhill locations, I know a lot of my friends are starting to get pregnant. You can still work with Ariel virtually.
Yeah, absolutely. It's fun.
She's filling up though.
Set up my camera and we just work out together. It's fun.
Yeah. And like a lot of pelvic floor places are like 6-month wait.
I know.
So get in now, book a consult or even just chat. And yeah. Hopefully this was helpful. It was helpful for me. I was taking notes over here.
Yeah. You're going to go back and listen to this again later.
I will.
Well, you guys know where to find us. businessmusclepodcast.com. On Instagram at Business Muscle Podcast. I'm Dr. Ariel.dpt and Elise is Elise Kyra. We'll see you next week.